Good morning, everyone. Today is Thursday, December 6th. My name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL, and I thank you very much for joining into our weekly healthcare reform webinars. We don't have a lot of updates today, but I will go through them. And as always, questions are encouraged. You can ask those questions in one of two ways. You can either raise your electronic hand, which is in the control panel to the right of your screen, or you can type in a question in the question box and I'll answer that at the end of the webinar. So let's get started right into the agenda. We did talk a little bit last week about my meeting with the PayWho Ledge team and Representative Mike Tobash up in Schuylkill Haven. He was the one that sponsored the 1605 House bill, which would allow agents to charge a consultation fee when carriers are not paying compensation. That was not successful the first time it was introduced. So we are working to kind of scale down the broad language, make it more narrow in focus, and hit the highlights that we need. Because as we all know, commissions are not paid for February 1st through December 1st. December 1st effective dates. Only January 1st during open enrollment is paid compensation. So there's a lot of year left that if you are in this block of business that you would not get compensation. So we're working hard to try to get that rectified. Not so sure about the success of that yet, but I can tell you that we are committed to working on that. Of course, CVS Health now owns Aetna. New products with a new healthcare model will be forthcoming. CVS Health plans to reduce the amount of store space that's devoted to retail and shift more to healthcare. There's also a statement from Aetna. They said that our new company will have a local focus, engaging customers with the care they need, when and where they need it. We'll make a complicated system simpler for all, and will help people achieve better health at a lower cost. Well, if they can achieve that, then bravo for them. Let's hope they can. There is a hearing set for December 18th. U.S. District Judge Richard Leone said on Monday that he was concerned about the that's multiple companies' failure to get final approval from him for an antitrust settlement before they merged. So again, December 18th, they're going to have a hearing, and we will keep you informed as to those developments. Great opportunity, NEPA, Highmark East. They will now accept BORs, and they will be honored for 2019 for non-brokered groups. So they're going to also follow the BOR rule. If it's received before the 10th, then you'll get commissions the first of the next month. And if it's received after the 10th, then it will be the first of the month following 30 days. Deadlines for December submissions is attached, so be mindful of that, as well as the agent compensation. We did talk a little bit about that. So that is the 2019 compensation table for individual under 65 sales. Some good news, effective January 1st, CBC groups in the 2 to 50 market can offer an employee assistance program through Mazzitti and Sullivan. It's at no cost, so employers would just call that number that I have listed there. They'll get information in the mail as well after January 1st, and they can do a short setup call. So that's a really valuable benefit for a lot of reasons. It does give your employees of your groups a lot of opportunities to discuss some challenging personal issues, get recommendations for counseling, financial services. There's a whole laundry list of things that they offer that is a huge benefit to employees. Also, effective 1/1, nationwide group life and short-term or long-term disability will be adding an EAP, travel assistance, and identity theft to their program. So that's also good news. Pardon me. Commission retractions for under 65 and the over 65 med sups from Capital, they are still ongoing. A great deal of craziness is involved in all of the calculations. We are supposed to be getting a complete list in the next week or so to help us make sure that all of these retractions, first of all, are correct and that we are paying you accurately, and most importantly too is that they're paying us accurately in order for us to pay you. So continue to watch your statements and notify Brandy Coleman, our Director of Commissions, and her team with any anomalies or issues that you have discovered. We talked too about the Gemini weekly meetings. These weekly healthcare reform webinars will now go to an every Tuesday, starting January 8th, Gemini weekly sales and legislative webinar. And then we're going to have monthly Aries HCR healthcare reform webinars, and they're going to be held every second Thursday. And that inaugural webinar is Thursday, January 10th. So watch for more information on that. And that's it. That brings us up to our open discussion and any questions that you have. While you're formulating those questions, I will be back here on Thursday the 13th at 9:30 to answer your questions. So let's see what we have here. We have no questions again. I guess everybody is just making their Christmas or Hanukkah lists and checking those twice. As always, I truly appreciate you joining in. This is my contact information. If you have questions outside of this platform, please don't hesitate to get in touch with me. I'm always happy to help. And as always, I thank you so much for joining in, and I wish you a great balance of the week and a wonderful weekend. Bye-bye.